What is Kawasaki's disease? Close your eyes. Imagine a 5-year-old child who can barely move, is covered head to toe in rashes, with their skin peeling from their feet and hands, with bloodshot eyes and lips so chapped they are bleeding. This child can barely move. When they do move, they are struck with great pain, and if they are touched, they bawl or even worse, throw up. That's kind of scary, is it not? Well, imagine. This is a family member. It's your child. It's even you. Even more scary. These symptoms are all part of a disease that is known as Kawasaki's disease. Now, you may be thinking, Kawasaki? Isn't that a motor vehicle company? The answer to that is yes, but it is also the name of the doctor who discovered this rare and fatal disease that affects young children. So what makes me qualified to educate others about this topic? I'm not a doctor. Well, I have done some research on it, but not only that, my family was affected by this disease when my older brother was diagnosed with it. So trust me when I say I know a thing or two, because I've seen a thing or two. The point of this story is for me to educate you about this illness and explain to you how I've come to know what I know. In order to do so, I'll have to explain my family's experiences and incorporate the facts into that as well. So, it all started when my brother was 4. Illness struck him, and it was nothing my family or anyone in our local hospital had ever seen before. So after taking many blood tests, urine samples, EKGs, and other extensive tests, the local doctor sent my brother's information to the specialists at a much bigger hospital. My brother, whose name is Cooper, he seemed to get worse and multiple symptoms. The specialist informed my family that Cooper had a rare disease that usually only affects young children, usually males, ages 5 to 6, and is most common in people of Asian descent. So Cooper, being a 4-year-old blonde-haired, blue-eyed boy, was somewhat of an odd case. One of the many things to know about this disease is that the symptoms come in 3 phases. The first phase, the child has around a 102.2 degree fever with red itchy eyes, and he begins to develop a rash. The child's tongue swells up looking much like a strawberry, which causes great pain and discomfort when trying to eat anything. This lack of eating usually leads to dehydration, which causes the child to experience extremely chapped lips and horrible diarrhea. In phase 2, the child develops horrible joint pains followed by harsh abdominal pains. The skin on this child's hands and feet also begin to start peeling away, beginning at the tips of their fingers and toes. Not only are they in extreme pain, but this pain causes the child to experience a lot of vomiting. Without treatment, this disease can be fatal. After the 2 first phases, the worst of it seems to have passed. The 3rd phase, everything seems to clear up and the child begins to regain strength. However, due to high stress levels from the fevers, the child's heart can develop coronary aneurysms. This is why this disease is so fatal. This means one hard hit to the chestal region could cause internal bleeding from the heart, and that poor innocent child could be gone forever. Sadly, there is no known cause of this illness, other than that it is possibly caused by a genetically transmitted immune disorder or an unidentified viral disease. So how do you correctly treat this disease? Well, there's no specific treatment for it. During the beginning stages, patients often have to have fluids pumped into their systems to reduce the dehydration. They also are given plasma that is infused with immune proteins that help reduce the risk of coronary artery problems. Patients are also prescribed high doses of aspirin to thin the blood to make it easier for their heart to pump it through and reduce inflammation. This disease is rare to get. This was my brother's life. Not once, like most cases, but twice. After Cooper healed from it the first time, when he was 4, he got it again when he was 8. This put even more stress on his heart. He wasn't allowed to do a whole lot of physical activities up until he was in the 7th grade, due to all of the stress his heart went through. For whoever is watching this and is concerned, know that the rate of those who recover is now quite high. And my brother, as an example, he does all of the things he was told he'd never be able to do. This disease may be rare, but it is something that deserves to be known, and people should be educated about it.